Hey, it's Matt here with Midwest Medigap. I want to talk to you about why a cancer plan is very important to go along with your Medicare plan. And even if you're not on Medicare yet, why a cancer plan could be valuable added coverage to your current health insurance. Let's dive right into it. As you probably already know, a big issue we're having is cancer cases continue to rise. Each and every year, it seems like more and more people are diagnosed with cancer. Just this past year, 2 million people will be diagnosed with cancer at some point. And the biggest demographic here statistically, and why a cancer plan to go along with your Medicare plan is especially important, is we'll just look at the demographics of the age where cancer is most prevalent. Age 60 and up, you can see statistically that's where you're going to get the greatest odds of a cancer diagnosis. So even if you're not on Medicare yet, I'm 39 years old as of this video. People my age I know are also unfortunately getting diagnosed with cancer. So it's happening more and more, and even if you're not on Medicare yet, you still can get one to pair along with your current coverage and fill in those gaps where you may have some large out-of-pocket costs with your current insurance. Now, here is why a cancer rider with Medicare is very important. Traditionally, how they've done chemotherapy treatment is with the IV, which is done at the doctor or hospital's office, which would fall under Medicare, and your supplement plan would cover it all. Well, fast forward today, how a lot of chemotherapy treatments are done, they're treated orally with a medication. Well, guess what? Your supplement plan does not cover that. That would fall under your prescription drug plan. So even if you have a prescription drug plan, these cancer drugs still are thousands of dollars out of pocket that you'd be responsible for. So that is why we recommend you add on the cancer coverage to help pay for some of those out-of-pocket costs that you're still going to incur, even if you have a supplement and prescription drug plan. And you can see here, even with a Part D drug plan, your out-of-pocket cost with your drug plan for some of these cancer medications, you're still looking at over $7,000 on average as a yearly out-of-pocket cost. Now that's if the drug is covered under the plan. Now some of these, not every single drug is covered on these Part D drug plans. Now most of them are, so hopefully yours would be, but even if it is, you're still looking at several $1,000s out of pocket. So how does a cancer rider work? Basically, you can choose between a $5,000 all the way up to upwards of a $50,000 benefit. And that's a lump sum benefit to you. So if you get diagnosed with cancer, they're going to send you a check. The insurance company will send you a check for whatever amount that your benefit is. Now, most people on Medicare, we see the $10,000 amount be about the most popular, the most common, and we find that is the one that is enough to cover you for, even if you have a supplement and drug plan, those out-of-pocket costs, it should at least give you a year's worth of coverage for that. But you can go up above 10,000, but that's the one we just see as most common. And the cost is based on your age. So a person who's 45 is going to pay less than someone who is 75. So most people around the age of 65, you're going to pay about $25 a month for a $10,000 benefit. Okay, and if you do the math on that, it's going to cost you about $300 a year in premium. Well, you pay $300 a year for your $10,000 benefit. That's going to take 33 years to break even. So the cancer riders are very inexpensive, and for the amount of coverage that you get and for as little as it costs, it is a great deal for the client to take a cancer policy out. We hope it collects dust and you never need to use it. And if you do, anytime within 33 years, you're going to come out ahead. So it covers out-of-pocket exposure on drug costs, helps pay for non-medical related stuff too. This is a thing a lot of people don't think about. Say, okay, well, I'll pay out of pocket. Well, you also got to think about the non-medical stuff. So like my grandmother, for example, she had breast cancer, and she lost a bunch of weight, so she had to go buy new clothes, wigs, She got 2 weeks. She didn't want to cook anymore, so she had meals delivered. Landscaping for the house. Somebody had to take care of the yard, so pay somebody to come do that, take care of the house. And then she had to travel to doctor's appointments all the time. So, sometimes she spent the night because she lived in a more rural area. So all those things, all those costs add up. Those are all non-medical costs that people don't think about. So even if let's say your supplement plan covered you for everything, you still have these non-medical costs that people don't think about, where a cancer rider does help out tremendously. So it pairs great with whether you have a supplement plan, whether it's Plan G or Plan N, or you have a Medicare Advantage plan. It's going to work well with any of those plans. Now, what if you're not on Medicare yet? We see a lot of people purchasing the cancer plans who aren't on Medicare yet. In fact, one of the biggest demographics we see people purchase the cancer plans are the folks who are maybe going to keep working past age 65, or they're in their early 60s and they're on employer insurance. Most employer plans with a cancer diagnosis, you're going to see upwards of a $7,000 to $10,000 deductible is pretty common on a lot of these employer plans. So that's going to be your out-of-pocket responsibility. A cancer rider fits perfectly with an employer-based plan, and it will come in and pick up those gaps for you in your coverage. So if you got a check for $10,000 with a cancer diagnosis on an employer plan, that's really going to help you out with those out-of-pockets and deductibles and co-pays that you'd be responsible for. And also, we see a lot of people purchase them before they are on Medicare, because what it does is it locks in the price for you at, if you're only 63 right now or 64 and you're staying on your employer insurance, well, you can take a cancer policy out and it locks in your price at the age you are. And then once you do retire and go on to Medicare, well, then that policy will stay with you. So you just basically protected your insurability. The other thing is, too, these plans, you do have to answer health questions. So the only time you can take it out is when you are healthy enough to qualify. If you've had a recent cancer diagnosis or anything abnormal going on at the moment, you wouldn't be able to qualify. So it's always best to take it out when you are healthy, and it does protect your insurability for the future. If you have any further questions with this, or would like to see if you qualify for a cancer plan, you can pick up the phone and give us a call, or if you're already working with an agent with our office or one of our advisors here, just reach out to them, whoever that is that you're currently working with. If you don't have somebody you're working with from our office yet, just give us a call here. We got the 800 number on the screen, or a local 515 number. So it rings into our office, and we'd be happy to set you up with more information, or go over what your options are in your area. So thanks for watching, and we'll talk to you soon.